Welcome back to the Oral Surgery Sisters podcast. I'm here with Kimiko Agari, my sister. She is joining us remotely in Los Angeles, California. And we are joined today with Karen He. Hi, Karen. How are you?
Hey, how's it going?
Great. So, Dr. Karen He, she is a fifth year oral surgery resident at UCLA, and she happened to be here in Las Vegas this weekend. What brings you to Las Vegas?
I'm actually here to attend the KLS SWORD conference. It's a conference on pathology and reconstructive surgery, and it's going to be from today until Sunday. So,
Nice, nice. Yeah, I remember when I was a resident KLS, they would have these sword conferences. And yeah, they would have them in different locations all around the world, not just in Vegas, but it would be all over the world. And there'd be different concentrations, different breadths of oral surgery. But this one, this weekend, it's head and neck.
yes,
Okay.
specifically like head and neck pathology, reconstructive surgery. I know they had ones in previously on orthodontic surgery and trauma. I think the last one was in Jacksonville last year.
Oh, that's cool. Are you interested in head and neck?
I'm not quite sure what I want to ultimately do, but all the options are open and or I'm keeping all my options open and I'm just exploring to see what I'm most interested in.
Great,
Yeah.
great. But like I said, so you're a fifth year resident. What are you on right now as far as in your residency program? Because when I was a fifth year resident, my fifth year was more like trauma surgery and then dental alveolar at the dental school. But every fifth year could be very different at different programs.
Yeah, so our fifth year is starts off with Gen Surge, which is carried over from the fourth year. So we start Gen Surge halfway through our fourth year and then finishes halfway through our fifth year. I'm currently in month 10 of 12, so I'll be finishing up at the end of this year and then going back on oral surgery after that. And so I've been on
Nice.
trauma.
Nice, you're almost done.
Yeah,
Yay.
I'm in the final stretch. I'm currently on nights, but I've been on trauma, going to neurosurgery next. I've been on vascular and like surgical oncology,
Oh, wow.
whole breadth of things.
Yeah, general surgery, it can definitely make residency programs very different from each other. Kimiko, what were your general surgery rotations?
Yeah, I think even from when I did general surgery to the general surgery rotations right now at USC, and even probably maybe from you, it kind of varies year to year. But for me, I did ENT, plastic surgery, anesthesia, orthopedic surgery, one of the ACS trauma rotations, transplant.
Oh yeah, I did
Yeah.
transplant.
Yeah,
Uh,
yeah. I don't think they do that anymore. I think they do
oh, transplant
vascular
was
or
crazy.
urology.
Did
Yeah, I
you
think that was
get
one of
on
the
the
harder
plane?
rotations.
Did you get on the
Yes.
plane?
I believe
Okay,
I,
tell it. Okay,
I did
well,
participate in it. I
so I couldn't get on the plane because USC had that one thing where I don't know, it went kind of viral, but
Oh,
you guys know
I
what I'm
don't know what
talking
you're
about?
talking about.
What
I
happened?
have no idea what you're
There
talking
was like
about.
a plane, or there was the plane crashed, or the helicopter crashed, I think, on top of the roof, and then
Oh,
the
I didn't hear about this.
yeah, and then the person transporting the organ, it like fell out of it fell on the
I did
ground.
not hear about this.
Okay, I think it was somewhat related, but it was also COVID, and so we weren't getting
Yeah.
planes or helicopters. We were just traveling via these giant Escalades, which was still super nice. Uh, but yeah, transplant was wild. So the way it would work is you don't know when an organ is going to be available. So when an organ becomes available for our patients who require a transplant, specifically for us, I was on liver.
Yeah.
So when it's ready, you gotta go. You gotta get in the car, you
Yeah.
gotta get on the plane, you gotta go no matter what time it is. And so my team, I think they at like 12 in the morning, they were like, "Okay, Christy, you want to go on I forget what they called it. They had a what would they what do they call it when they get the
The retrieval?
like a retrieval or something. They would call it like do you want to go on a retrieval? I'm like, absolutely, you have to go on it at least once. And so there was a big Escalade waiting for us at the front of the hospital, and we got in and they had got us food. That was really nice. And we went all the way to Bakersfield. We did the retrieval, and it's not just liver. There are a lot of other or surgeons and physicians there that are there to harvest and retrieve the organs for different patients that require them. So I think there was one for the lung, the heart, the kidneys, of course, liver, and everybody, you know, retrieves these organs for their respective patients, but also very in a very respectful way. They're very respectful to the patient, very thankful to this patient who was donating their organs, and to the family too. And then you get back into the car and you go back to your hospital and you do the liver surgery and
Oh
the
wow.
transplant for the
So you do
patient.
both. You do the like the harvesting and also the
That's at least what my experience was on
Yeah,
my
I think
rotation. It was crazy.
for us, we had a separate retrieval and transplant team. So as soon as there's notice that the organ is available, then you have your team that's on the retrieval part of the team prep and plan and basically travel out to that location and then perform the harvest surgery. And then obviously at that point then there's a time crunch, and so you get back to the hospital as soon as you can, but during that entire time the surgical team back at your home institution is making preps to get the operating room ready and get the team ready to perform the transplant surgery, get the patient prepped. And so they're doing things at your home institution while the retrieval team is going to retrieve the organ. And so it's all very coordinated, and there's many people obviously participating in this entire orchestra of getting this patient their
Yes. Yes.
organ.
See, you did better on your transplant rotation than I did. I just remember
No,
the
that
Escalades
was
and the
it was a
flames.
really tough rotation because it's a lot of times if you decide to go on the retrieval, then off depending on where you're going, then it oftentimes spills into well past you when you would give sign out, let's say, as an intern. And so it's kind of tough because depending on the time of day, you're like, I do want to go on this retrieval and I want to see that and have that experience and help the team. But at the same time, it's kind of tough because it's like, okay, if we're starting this process at 5 p.m., I don't know what time I'm going to get home. I have to be here, what, at 5 a.m. tomorrow to start rounds as the intern on the team. So I remember it was really tiring and kind of chaotic in
I
terms of the
just
schedule.
remember wondering, not just how do these surgeons do this? Like the transplant surgeons, bless their heart. It's a very
Yeah.
hard lifestyle, and they are truly saving lives. Sometimes I kind of
Yeah.
laugh when
Mhm.
people, I mean, we do trauma, we do take trauma call, and we are quote unquote saving lives, I guess, when we are doing that. But still, like oral surgery, when people are like, "You're a doctor, you're saving lives," like not really. I don't think we deserve that level of uh that's that
Saving faces.
yeah, we're saving faces, but I don't know
I don't
about
think you're giving us enough credit. I think
yeah,
we improve lives and
we
we improve
do.
function and
We do.
aesthetics and we
We do.
restore. But I
We
think what you're
do.
getting at is these other specialties that do transplant
Yeah,
surgery. Like
without them those patients
unfortunately,
would
it's life or
die.
death for them. Yeah.
Yes. Exactly. Exactly.
There's a role for
But
all of us.
Yeah.
yes, there is a role for us.
There you
Very
go.
well said. Love it, ladies. Yeah, but so that was basically our general surgery rotation. One of the questions I would get asked, or I wouldn't get asked. One of the questions that I would hear a lot when I was on the interview trail was like, "Oh, is your general surgery like butts and guts?" And I remember talking to you guys, and you guys were like, "What are you talking about?" But like the butts and guts would be more like, "Oh, your general surgery rotation is more like thoracic foregut, colorectal surgery, um, non-invasive, yeah, cardiac, like the lap appies and the lap choles, like that kind of stuff. Whereas, is this program more focused for our specialty as in oral surgery? So, yeah, you could,
ENT, plastics,
yeah,
neurosurgery.
which was more my experience. So yeah, I don't know if
Yeah,
you
I
have
think
any
I think we
thoughts
are really
about
lucky.
that.
I mean, it just depends on what you want, but for us, and I think as oral surgeons, obviously you're going to prefer the rotations that have more overlap with your specialty. But I think we were pretty fortunate with our general surgery rotations. We had a lot of plastics rotations, ENT rotations, and kind of minimized those other more general surgery heavy rotations. But how are your rotations at UCLA, Karen?
Um, so I think it's different every year. For me,
Okay.
it's been a mix. So I've had some surgery rotations that are more similar to oral surgery, like neurosurgery, and then also oral surgery itself, because we have 3 months back on service during Gen Surge. And then the rest of mine have been like cardiothoracic surgery, like outpatient surgery, which is nice because it's a lot of breast cases or mastectomies.
Yes.
And then what else? Vascular surgery, which is
Ooh,
cool, but very different from oral
that's
surgery.
tough.
Yeah.
Yeah. Um,
Uh,
What's been your favorite general surgery rotation?
Probably
Oral
outpatient
surgery.
surgery. Oh, yeah. I mean, non-oral
Yeah, yeah,
surgery
yeah.
included, probably outpatient surgery, just because it felt like the most similar to the type of surgeries that we would do, meaning like they're more they're less morbid. Patients are healthier. They go home the same day or they stay overnight. And as an intern, I got to participate more in those surgeries. Like, I'm certainly not doing any cabbages as an intern, but
Yeah,
on
yeah.
outpatient, I got to do parts of the mastectomy, and
That's
yeah,
great.
so that was a good experience for me.
That's great.
Yeah. What
That's
about you
great.
guys? What were your favorite rotations on Gen Surge?
Well, okay, personally, I I had a really good time on ENT and orthopedic surgery, but more so because I just remember the people on those services were really fun. We had a good time. Uh, ENT was really applicable to what we were doing. Uh, but I just like when you look back on your experiences, y- it's hard to remember certain consults. Obviously, the crazy ones stand out, but day to day, hard to remember certain consults or the patients, and you remember information uh, and learning points about different services. But I had a really good time with the people. Like I made a lot of friends, and like we're still friends to this day. So probably those services. Yeah, we get along pretty well with those services. Kimiko, do you have a favorite gen surge rotation?
I think you both bring up a good point. I think it's my favorite rotations were based off of how much you got to do as an outside oral surgery resident coming onto another services rotation. So if they let you participate in the operating room, or if it's more applicable to oral surgery. So I would say definitely plastics and ENT. I think also because we work really closely with them with our residency programs at USC, then we're more familiar with them. They let us do more. They let us see more consults because obviously they also take face calls. So I just got to participate more on those rotations. But like you said, it's also the team, like the other general surgery rotations. I think for the most part there my team was always pretty good. And so I felt like I was always having a good time. Obviously some of it was really like things that I would never do again and made me happy seeing those surgeries and
Yeah,
those
like an
patients
organ retrieval.
made me really happy that I had chosen oral and maxillofacial surgery as a career choice, but I enjoyed being on those services and learning those specialties for that month or however long we were on it. But I would say other than plastics and ENT, I don't know. Maybe I really don't know. I think those were two were my favorite.
Yeah,
But
those are
otherwise
some good ones. I had
it
a
was
good time
more
on
just hanging out.
plastic
Yeah.
surgery too. Yeah, just hanging out. Great. Well, Karen, I wanted to say happy belated birthday to your daughter.
Oh, thank
She's
you.
1
Oh,
years old
yeah.
now. Congratulations.
Thank you.
Yeah,
So that means though
congratulations.
you had your daughter while you were a resident, over a year ago now.
Yes.
Um, Kimiko and I get asked a lot, how do you have a family while in residency? Is it possible? When's the best time to do it? And it's very difficult for us to answer those questions because, of course, we didn't do that while we were in residency. Um, so yeah, we'd love it if you could share your experience or any pearls of wisdom that you might have, and
Actually,
just
yeah,
help.
I have a question. So, or just to
Okay.
start to start it off, is having a family and starting a family in residency, is that something that you always plan to do, or it kind of just happened that way? I think a lot of, like Chrissy said, we get, I think a lot of women who are interested in the field of oral and maxillofacial surgery have that question before maybe in dental school when they're applying. Is this, if they're planning to have a family, is this something I should do in residency? Should I plan to do it afterward? Does that affect whether I want to pursue a 4 year or a 6 year program, for example? Is this something that you plan to do, let's say when you're applying for residency, or something that you thought of beforehand?
I so I got married back in dental school in 2018, and so I came into residency with my husband following me to California, and so we had talked about it, and it was kind of like, one of those things you talk about and you're like, oh yeah, like someday,
Mm-hmm.
this is something that'll happen. Like we'll have a family. We didn't talk specifically about the timeline. I think it was more of just like a naturally evolving conversation between my husband and me. And once I entered residency, obviously the first year intern year is crazy, and so I didn't think about it at all. And then once I got into medical school, so that's years 2 and 3 at UCLA, I started thinking about it more and more, especially as I had more time. And I also went on rotations where I was exposed to kids like pediatrics and then also
Mm-hmm.
OBGYN. Um, and then also, even like on medicine, when I was exposed to patients at the VA, I got time to reflect on what I cared about, what I wanted. And talking to, believe it or not, talking to like elderly veterans convinced me that I wanted to have my family, and that was something that I wanted to prioritize because those patients, I noticed that the ones that were happiest while getting treatment at the VA were the ones that had families who come visit them. And so
Oh, that's so cute.
I
I
Sweet.
love
remember
that.
thinking at the time, I was like, no matter what I do, I'm going to have a family because I don't want to regret at the end of my life. Like, even if I have a very successful and fulfilling career, I think I would regret not having a family. Um, and so then the decision became like, okay, when am I going to do this? So by the time I really like seriously started thinking about it, I was already halfway through medical school. So I had 1 year left to try to basically deliver my daughter before the end of medical school. And the reason why I wanted to do it then is because medical school is actually one of the more relaxed, or one of the easier portions of residency. And so I tried really hard to make that timeline work. Unfortunately, it didn't work out perfectly, so I actually ended up getting pregnant towards the latter half of medical school, and then I delivered my daughter right at the very end when I came back onto oral surgery.
Wow. So you
So
were
Wow.
like taking your step exams,
I took my
getting
steps
pregnant.
free postpartum, like
Oh my
during my
gosh.
maternity leave.
Amazing.
So yeah, the thing that makes this
Crazy.
possible is having a plan, um, figuring out ahead of time, like months ahead of time, what your schedule is going to be like and how your time off is going to affect your program, your co-residents. Um, Obviously, I didn't tell everyone like before I knew I was pregnant, and I waited until the end of my first trimester once I confirmed that, things were likely
Hmm.
to happen
So
for
this
real.
isn't so this isn't something that you discussed with your program beforehand, or like tried to time out with them beforehand.
No, because I I didn't think that that
Yeah, it's a
was,
personal decision.
yeah, it
Hmm.
was my decision. And so once I
Hmm.
was past the first trimester, I knew that, like probably 95+% chance that this pregnancy was going to result.
Hmm.
I started letting people know, and I started with my program director, and then we worked out when I was going to be gone, and then I talked to the chiefs, the current chiefs that year, to let them know like what dates I was going to be off for maternity leave, and then they were able to like know ahead of time so that they could find like appropriate coverage for a call because I was supposed to be on service during that time. And so I had a very supportive environment at work to help ease things and make sure that I wasn't, leaving anybody hanging by leaving for maternity leave. I also have a really wonderful and supportive husband with a very flexible schedule. That's the other part that makes this work, is that once you have your kid, that's when the real work begins. And unfortunately, with residency hours, you're not going to be able to be the primary parent. And that's just the truth. You cannot be the person who drops off and picks up your kids. You can't do the doctor's appointments during the day. You can do some, do a little bit of more work when you're at home, but you're just not that home physically that many hours a day. And so my husband does the lion's share of childcare right now. And then I also had family nearby, which is very helpful. And then on top of that, my husband and I also pay for additional childcare so that it gives him some flexibility so that he can have time for himself as well.
Wow, it sounds like your husband's very supportive of your career and your family and really understanding. That's great because it can be difficult to find that person just for anybody just out, in someone without a career in oral surgery. So it's great that you have someone that like that in your life who's very understanding. It sounds like that's a big key to the reason why this so far has been quite smooth.
Yeah,
That's
I'm
great.
very, very lucky. And I feel like if you don't have a supportive partner who is aware of how much they have to take on once you start a family during residency and like how much of solo parenting they will have to do, I probably wouldn't have decided to like go forward with having a child during residency. I would wait.
I have heard, or I have heard from some people applying when they were trying to decide, oh, as a female, should I do the 6 year, should I do the 4 year because I want to have um, a family, I want to get pregnant during residency. I've have heard some people say, oh, I want to do the 4 year because I'll get done sooner and then I'll have my kid right after. And I've had some people say, oh, it might be easier during the medical school years. Um, I don't, do you have any, what's your thoughts on that given like you've gone through it? It sounds like you feel like the 6 year was more conducive.
I honestly didn't factor that in when I was choosing between 6 year and 4 years. I just knew I wanted to go through a 6 year program and get the MD. I wanted to make sure I had like all the options available to me, no matter what path I chose afterwards. So I didn't even think about whether or not the 6 year or the 4 year was more conducive to starting a family. But once I actually started residency, I realized that previously people had told me go to a 6 year so you can have time to have a kid during residency because the 6 year has the 2 years of medical school, which is the perfect time to have a child. But the problem with that is that after you have your kid, that's when the work begins,
Yeah.
right? Because being pregnant and delivering, or
Which is,
yeah,
I can't imagine being pregnant in medical school. Like,
No.
I mean, because you still have to go study and go through stressful rotations, and it's just wild that you did that. Like, props to you. And I know there's a
Yeah.
lot of women, not actually, there's not a lot of women that go through this, but they go through it, and it's just wild that you guys do, and you're really successful still while going through this, in your personal life.
definitely didn't feel like that at certain portions of my pregnancy and
Did
postpartum.
you take any time off afterward, Karen?
I did. I took off 8 weeks for maternity leave, and that is
Mm-hmm.
thanks to our a resident union at UCLA, which allows all
Mm-hmm.
residents to take 8 weeks, regardless if you're the birthing parent or or I guess the partner.
Nice,
Yeah.
nice. Yeah, and for the people who say, "Oh, like I'll do the 4 year because it's shorter, and then I'll have a kid right after," I will say, at least me going into private practice, you think it's gonna be more chill, but it's still life is just it's a lot of work at all stages of your career, not just residency, but in private practice. There's a lot of hustle in the first couple years that you're out because you're establishing yourself as a surgeon in the community, and you want to continue to do good work, and you want to stay on top of your continuing education and the latest techniques and get to know your community. And so you're still busy. And then you're also studying for boards. The first year out, you're studying for boards, and that takes up such a large portion of your life. And the stress is probably not healthy either, especially if you're trying to have a kiddo. It's probably not healthy for your baby. So when people say, "Oh, it'll be so much easier. I'll have so much time after," I don't know. There definitely is more time and like more of a predictable schedule in residency, but it's like what then residency, but it's like what they say for anybody that's trying to have a kid is that there's no right time,
Yeah.
right? They always say that no matter what career you're in, right?
But you would say, like, overall, if you had to.
Oh, you can do it. Yeah, you for sure can do it. I think at at the end of the day, if you have a supportive partner, or you have maybe not a supportive partner, but just support in your life, then you probably could make any situation work. Just there will be periods in your life that, of course, it might be a little easier than other periods in your life, but there's probably no ideal time ever, you
Yeah.
know.
Well, I will say the 2 years that you should not have a child: intern year, gen surg
That's good
year, and
advice.
chief year.
Okay, intern year,
Medical
gen
school.
surgeon, and chief year.
Medical
Medical
school
school's the
is
best.
Medical
right.
school.
And the reason is because when you're pregnant, you can't be doing like 28-hour calls. You can't be
Oh
doing days,
yeah.
nights, home call because your fetus is going to suffer for it.
Oh
Yeah.
no.
If you stand in the
Yeah.
ER for like 8 hours a day, that's not good.
Yeah, intern year for sure. No.
Yeah, I think you're right. I think there's no good time. There's no easy time because obviously you're always hustling.
Yeah.
But I can't imagine. I don't know how you did it, Karen. I can't imagine being pregnant and having a child during residency. If you, I just look back and think about all of the rotations. It's you're truly just a slave to the schedule and the system and the hospital with the pagers going off. I don't know how I don't know how you're doing it,
Yeah. What
but
question?
I don't
What do
know.
you do if you're pregnant and you're on your anesthesia rotation? Because there's a lot of
Oh,
gases that you don't want to be exposed to.
I think so. I wasn't
I don't know.
pregnant on anesthesia, but I was in the OR at certain times. I remember asking an anesthesia resident, and they said like during their first trimester, they just try not to put them like in certain cases where they use nitrous.
Mm.
Um, but I don't know about like general anesthesia cases and how they.
Yeah, seems like it would be tough. I know you leave the room on induction. Uh, I don't know. We need to get an anesthesia
Yeah,
friend. We need to
I've
phone an
definitely
anesthesia
seen
friend.
pregnant
Yeah,
anesthesiologists
definitely.
during induction and extubation, so
Definitely.
they
Maybe it's just
definitely,
their
yeah,
choice.
they
Yeah.
Ye-
definitely do still participate.
Yeah.
But
Yeah, I that's SIVO is strong. I remember I was in a dental anesthesia case, and they were masking down for induction, and there was a SIVO leak, and I could smell the SIVO, but it must have hit me so fast and so hard. I just remember thinking like, what's that smell? And then I almost passed out, but then the last
Wow.
second someone in the room was just like, get guys, get out, like SIVO leak, get out. And then we just walked out of the room, and I was just like, whoa,
whoa.
whoa, what just happened? That was so weird. So yeah, it just seems like maybe that wouldn't be safe for the baby if you're in those situations, but
Unfortunately, I feel like there's a lot of things that you do as a resident that are
yeah,
not safe for pregnancy,
they're
but
just like not safe.
you just don't
Yeah, that's
think
probably
of
like
like
the
standing in the
least
OR.
thing.
Yeah,
I,
yeah.
you're
I know
not
people
eating,
that
you're
have
not peeing.
they've stood in the OR for so long that they've gotten a UTI because they were
That's
like they
terrible.
got to stand in the OR. They refused because you know how it is. Like you don't want to be weak. You don't want to scrub out and go to the bathroom. Like we can bear through this. And I know someone. Yeah, they stood in the OR for so long doing surgery, held their pee and then like they had a UTI like
Yeah.
24 hours later or
I remember when
something.
I was pregnant, I was like in my third trimester, and you work with a lot of attendings, mostly male, but the ones that are so the ones that I work with that are male, like they don't know what it's like to be pregnant, and so I remember I would have to speak up and be like, "Hey, it's been 2 hours since I peed. I'm gonna scrub out real quick and I'll be right back." And they'd be like, "Oh yeah, 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 go, 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 go," and they would feel so bad that it didn't occur to them um, to remember that I was pregnant
Oh my
and that I
Yeah.
gosh.
needed certain accommodations. But everyone I worked with were very, very kind and like more than happy to let me have like time off
That's
to
great.
take care of something. Like, if I was nauseous, I would step out of the OR. If I needed to sit and like eat something because it had been like 8 hours since I eaten anything,
Oh my
like I
gosh.
would I would just leave and come back, and no one ever had any problems with it. But it took me a little bit to like speak up about it because, like you said, as a resident,
Yeah.
you don't want to be the weak one and be like, I want to scrub out to eat or pee or
Yeah.
or
Yeah.
just take a break.
Yeah.
Karen, how long did you breastfeed?
So I breastfed for about a month during maternity leave, and then I was gearing up to go back to work again. So I started pumping during that time. And then once I
Okay.
started pumping, it was like I discovered freedom and I realized I didn't have to be chained to my baby
Yeah.
24/7 because when you're breastfeeding, it's like every 2 hours your baby's got to eat.
Mhm.
So every two
Mhm.
hours of like the day, so 12 times a day, I would be breastfeeding for the first month. And it was
Wow.
so miserable.
Yeah,
Because
yeah.
no one else can replace you. And so
Yeah.
you're waking up like every 2 hours during the night
Oh my
or like every
gosh.
day. You can't go too far because you need to
Yeah.
breastfeed. So then I started pumping, and that freed me up to like go places and do things and also sleep through the night while my husband or my mom, who was staying with me at the time, could help take over. And then I did that for about 4 months full time. So I was pumping full time, which is interesting because when you're in clinic, like you have to you have to
Okay, so you were
excuse yourself
pumping
and go
at
pump
work.
every couple of hours, or else you will start leaking. Um, and then so I did that for 4 months, and then I started weaning, and then by 6 months, we had completely switched my daughter over to formula, and that was I think that decision was made because I wanted to give her breast milk for 6 months. But looking back, I think if it's not working or if it's too much of a burden, I honestly saw no difference from when I like, gave her breast milk versus when I fed her formula. She still grew just as well. She didn't fall off any growth curves. She was just as
Yeah.
healthy. She never got sick. So,
Yeah. Yeah. I think I don't know how I know this, but I know, well, I was like a couple months premature because I'm a twin. And if you know my mom, she's like really tiny. We were just, and usually twins are premature, but we were like 2 months premature. And they said we were like 2 pounds, really little, really gross looking. And so we couldn't be breastfed and we were always on formula. And like, I'm a doctor. So
You turned out
I,
okay.
yeah, I turned out okay.
I think I
So,
agonized over
oh
stopping pumping, and then I did it one day. I
gosh,
just like
they just, I feel like there's a lot of guilt on moms for so many
Hmm.
things. And not that I'm a mom, but I see it with my friends. And from the outside looking in, I feel like there's just so much guilt put onto mothers, especially who are working. Like one of my friends, she was telling me, she was just like, I feel like I just can't win because when I take time off from work and I'm not working as much, and I'm taking care of my kids, then people are like, "Oh, you're just you're not working, like, and you're a stay-at-home mom, and your man's making all the money." And but then she's like, "But when I go back to work and I leave my kids at daycare, then there's other people that are like, "Oh, you're not taking care of your kids yourself. You're just leaving your kids with a stranger. Wow, what kind of a mom are you?" So she was like, "I just can't win," and I'm like, "Oh, it's just so much guilt put on." Like professional working mothers. It's not fair. It's
yeah.
just not fair.
Yeah,
Yeah.
fortunately, I have a very supportive community around me, and I just don't I try not to listen to the
That's
noise.
good. You shouldn't. You
Yes,
shouldn't.
and
Because
as long as my husband is, is supportive um, and we have a good like working relationship, taking care of our daughter, and he's okay with doing the majority of the work while I'm in residency, and he doesn't feel badly about it. That's all that matters to me.
I love that.
It
I love.
probably it probably helps that you're in residency. You're probably just so busy on general surgery and whatnot that you don't have time to listen to all of this extra noise from
Mom
people.
gossip.
The mom
Yeah,
goes,
like I'm sure you're
yeah,
not
you don't have
having
time for
time
that
to
noise.
scroll. Yeah, scroll on Instagram and see all of the judgment from other people and all the things that other people are saying.
You're a great resident while being a mother, but besides being a mother, you just are an excellent resident. And I'm just wondering, do you have any tips for other future residents or current younger residents on just tips for being a successful resident, getting through residency? Any knowledge that you can give to the world?
First of all, thank you for saying that, but that's not that's not how I feel all the time. When you're juggling between residency, being a parent, being a partner, it can feel like you're not doing enough at all times in like all three realms. Um, and so that's something I definitely struggle with is feeling like I'm not enough in any of those categories, either like at home, as a mom, as a wife, as a resident. In terms of advice, for younger residents, I think the best advice I have is to maintain a good attitude no matter what stage you're at. And the reason I say that is because your attitude it can it can make your experience good or bad. If you have a good attitude going into something, even if it's something that you don't want to do, or even if it's something that's hard and you feel is less productive for your learning, if you have a good attitude about it, oftentimes you'll find that that experience will be better than what you expect and opportunities will open up. People will want to give you opportunity and will want to work with you or teach you. But if you have a bad attitude about something, it shows, and that's when your expectations about that bad experience come true.
I want to go back to what you were saying about like sometimes in these three realms, like you feel like you're not doing enough. You know, I think most residents at one point in their career, their residency career, or even out in the real world working in their practices, I feel like most people feel that way. And in some capacity, I feel like the very good residents and the very good surgeons do feel like that sometimes because it's almost like this inner um this inner force to just keep trying to be better than you already are. And sometimes that makes a good surgeon or good resident is that you're striving to always become better, do better, be better for your patients. So I know it may not feel very good inside, but I think it's probably more that what you're feeling. Um,
Yeah, and I
yeah,
think
I don't.
we kind of talked about this before when we were chatting before, but talking about imposter syndrome and how I think that's kind of basically what we're talking about, where you just constantly feel this kind of persistent self-doubt about your abilities, about you where you're at, like in the residency program or out in practice, and just kind of feeling like you're not enough in all of these different categories. I think, like you said, that every resident is going to feel that, which makes sense because you're a resident, you don't know everything. But I think when I was researching this, um, there's a lot of studies that have been done that show that it's even stronger. That feeling of imposter syndrome is much more common and much stronger in younger female population, which is, all of us. And so I can't imagine, especially being a resident, being a new mom, being a partner, getting pulled in all of these different directions. I think it's kind of almost impossible not to feel that way because there's only so many hours in the day to get all of these things done and do all of these things. So I think as we go through life, it seems that that would go become less and less. But it's kind of hard for us to say because we're all in that like younger female category. We're all in residency or shortly thereafter residency.
At least all my juniors that I've worked with, a lot of them have expressed at one point just feeling like they weren't doing as well, or they weren't as satisfied with their work, even though I thought they were doing just fine. Those were usually the better residents, and actually the residents who are like, "No, I'm perfect, I'm good." Those were usually not the good residents. So, yeah, you, you know what I'm talking about, Kimiko.
Yeah, I know what you mean. I think it's a balance. It's a balance of like recognizing your successes and your wins, but then also being able to reflect and know when you've made a mistake and where you weren't as good. And so I think some people just naturally fall on either side of the line. Nobody's probably right in the middle where they can reflect well and say, "Oh yeah, I did great at that. Oh yeah, I didn't do great at that." So
Yeah,
it's
that
it's finding that
self-reflection.
balance.
Yeah, that
Yeah.
self-reflection is really important to improve as a surgeon every day of your career out while you're working, while you're a resident. But yes, if it does become a point of self-doubt and just being very self-deprecating, then it definitely is not healthy. And yeah, you have to reach out and talk to someone and just get your head back in the game. But yeah, a little bit of that
Yeah, like
self-reflection
it's
is
important.
healthy.
Yeah, it's important to have not self-doubt, but reflection that makes you step back and think, how can I be better? Or did I do this the best that I could and can I do it better? But then also to recognize when you did something good so that you can do it again instead of, like you said, be self-deprecating and think that everything that you're doing is bad or that you're not enough.
The difficult part about working on myself like professionally, which is something that I totally agree. I think you do need to self-reflect, figure out where you can be better and then work to be better. The hard thing now that I've had my daughter is that every every hour or every moment that you work on your professional self outside of your work hours is taking then like a piece of time or quality time that you can otherwise spend with your child or your family. And I didn't feel this as much when I was earlier on in residency because I hadn't had my daughter yet, and my husband also works a demanding job, and so I didn't have that same responsibility to spend time with him outside of work as I now do with my daughter. And so the hard thing is now when I'm at home, like I need to figure out how to divide my time so that it's both, fair to my family, but then also like try to find time to work on myself because as you both know, like residency doesn't end when you leave the hospital. The learning happens at home
It does.
after your like
Yeah.
70-hour
Yeah.
week. So,
That's a good point. Sidebar, I feel like many dental students who are applying to oral surgery don't realize is they think when you go to residency, the learning is at the hospital and the attendings are going to spoon feed you all the information
just
and
like
it's
dental
like a
school.
classroom. Yeah, it's like a classroom and you get your lectures. You do get didactics as we call it, but you're learning on your own at home. You're reviewing your cases that you just did and then the cases for the next day and the next week and it's very much yes,
Self-directed
it's
learning.
self-directed learning at home in your spare time. Oral surgery every day, all day, every day. Yeah.
Yeah. How did you guys study during residency?
It was
I
hard.
I have well, okay. I used a lot of PubMed and then the standard textbooks, the Fonsecas, the Atlas, um, and then I would listen to a lot of I'm like a podcast person and a lecture person. So on my drive to work, I would listen to Everyday Oral Surgery. There was a core anesthesia podcast that I would listen to. And then I would listen to just CE lectures like on demand. So, especially during COVID, I feel like it was more active. But there's ACOM, what's it? ACOM's
Yeah,
Everywhere, I think is
ACOM.
what it's called.
Yeah.
ACOM's Everywhere. They have a lot of really good lectures that you can access. I loved those. Um, Strawman has some good implant lectures. But there's like on demand things, and then around conference time, especially as a resident, you get a good discount. So you can get on demand lectures from the AMIS conferences and the Implant AMIS conference that happens in Chicago.
Oh.
And so I would do a lot of that. That's how I would learn, outside of residency.
Also, I mean, also like the sword course that you're there in Las
Yeah,
Vegas
see, look,
for,
you're
but
doing it now.
there you're doing it, you're doing it.
Yeah.
Yeah, I think all of that is good. I think you're right. I think after COVID, there are a lot more resources, a lot more like virtual lectures shared amongst various institutions via Zoom and whatnot that they didn't have as much of those before. A lot more virtual type lectures and things that are available. Like I think even podcasts are more new because like when I first started, it was a lot more textbooks and looking up articles and basically anything that Google would give me. Um, but I
Yeah,
think, but
you
yeah,
were
I
more
think
the textbook girly, and I
yeah,
would be
I would
like
do more
listening to
textbooks, and
podcasts.
then but yeah, we would go. We took some like some of the striker courses together, Christy. When
Those are
when we
fun.
got more higher up in the residency program, we were doing more hands-on because
Do
a
all
lot
of
of them are
those, any of
cadaver.
those that
Yeah,
you
the
could do.
cadaver
Yeah,
courses, those are really good.
the cadaver courses are awesome. Like any cadaver course you can go to when you're a senior chief resident, because it's it's funny because you go and you're like, I want everything to be perfect. And you do want it to be perfect. And we're very respectful to the cadavers and the people that donated in the name of science and learning. But also it is the time to make, like, if you're gonna make a mistake, you do it there. And it's just great hands-on learning, and you often can do more than just what they're directing you to do. Like, say it's a neck dissection, um, but then also it's there, and so you can also, I think, in the same breath, someone was teaching me like, oh, just practice doing like your sagittal split right here, and I got to do that. And like, oh, let's just learn anatomy here. Let's just dissect out the nerves. Let's dissect out the blood vessels. It's really good learning. And whenever I walk away from those cadaver courses, I feel just so energized, and I feel ready, like surgically ready. Um,
I
so
think
I love
also,
those.
yeah, those are really good. I think also it depends on I think a lot of it depends on what you're specifically trying to study. I think studying just to educate yourself for your own surgeries, for example, is a lot different than studying for a board exam or some sort of like written exam or med school exam. But I also found my like our ENT and plastic surgery colleagues very helpful because they have other resources for like let's say you're trying to learn or study for a head and neck like a neck dissection case or a flap or something maybe more in the realm of that has overlap with ENT or plastics. I think they also have pretty solid textbooks and papers and resources that are maybe not as common to us as oral surgeons or not as accessible. And so I think I got a lot of textbooks and papers and whatnot from my ENT and plastics friends as well.
That's a really good point. I agree with that. And I do this is a little controversial in oral surgery, but there are a lot of good periodontal textbooks that I think are excellent for soft tissue management. Uh, that is what they do, is they are very good at soft tissue management. That's what they do. And there's always more to learn. So I do pick up some perio textbooks here and there. I think that no, oral surgeons should not poo-poo them. They should welcome them and learn. There's a lot to learn there.
Yeah, agreed.
There and yeah, and I think it's really
Definitely.
good to have, yeah, it's really good to have these colleagues that you can text for advice, because sometimes I find that I'm texting my perio friend or texting my ENT friend just like, hey, I had this thing come in my clinic. What's your opinion? I even texted one of my orthopedic colleagues actually about an IV that I had placed in the wrist, and um yeah, the patient was having some weird like transient numbness, and it resolved, it went away and everything. But at first I'm like, well, it's an IV, right? Like we place thousands of these all the time. It was just so strange. So I texted like my orthopedic friend and then my hand surgeon friend, and just like, hey, but like separate. I was like, hey, this happened, and they both were like, oh, don't worry, it's gonna be fine and everything. But yeah, it's definitely like referencing your colleagues too is excellent. And then they'll text you too. They'll ask questions about. I think randomly I got a text from one of my plastic surgery friends about a root canal. Actually,
Yeah.
yeah,
I
yeah,
get so many of those types of questions, dental questions.
yeah.
That's probably the one of the more fun parts of Gen Surge this year is like meeting people who are from all parts or all subspecialties within surgery, and then collecting their contact information, and then hopefully we'll get to come across them either like sharing patients or give them advice on like what our specialty does or receive advice from them like you did.
Do you have any more advice for any young residents or dental students?
Yeah, the second thing which you reminded me of is to be teachable. So the first thing was attitude. Second thing is to be
Yes.
teachable.
Yes.
You are never too good or too experienced to learn something new, no matter what stage of training you're at, I think. And there's always something to be learned from everybody. And so staying humble and being willing to accept a new way of looking at things or doing
Yes.
things.
Yes.
That's really hard for some people, though. I don't know if everyone is teachable, in my humble opinion. I'm sorry.
At least when you're a
That's really
junior, if
hard
you're
for
a
some people.
student or a junior, you have to be teachable.
Even out as I have now progressed in my career, I have found that yes, you have to be teachable even when you get out, because if you join an associateship and you're joining a new practice, or you're joining just a new area, and every um area that you can practice in can be very different. The economics and the people there, the community you're serving, you are not going to be the master of that area of the or the master of the surgeries those patients might need. As a new person, you're just not. There is someone who is going to be the so-called established master there, and they may have great advice for you, and you have to be teachable in those moments. And I do know some people who have joined associateships and those have failed, maybe because they maybe not, I don't know if teachable is the word, but they definitely couldn't assimilate and take on the culture there or the techniques there. So yeah, being teachable is just a very good
Well, and
quality
I
in a
think just
surgeon.
being open to learning. I think
Yeah, being
that
open.
yeah, if you don't
Hmm.
your education does not stop after you graduate and finish your last day of residency. My greatest mentors who are and who my greatest and most experienced mentors are all kind of mimic that, and they're all open to learning and they're continuing to learn, and that I think is what makes them so great, is that they're continuing to learn and innovate and contribute back to the field of oral and maxillofacial surgery because they're continuing to have an open mind to this profession. And so I think those people that you like how you say people don't aren't successful in their practice or in their like their partnership or whatnot or the practice that they join. I feel like, well, sometimes it's just their personalities that just don't match, but maybe
Yeah.
they are just not open to learning and growing basically.
Yeah, some people, and you got to play in the sandbox, as we call it. You got to be able to play
Yeah.
in the sandbox and get along.
And some people can't do that.
Some
People
people
cannot do that.
can't.
So, Karen, as a fifth year, I imagine that you are starting to think about your life after residency. Can you walk us through kind of the steps that you are taking and maybe advice for other residents in your position looking for different job opportunities after residency?
Sure. So I'm like just beginning to like start looking right now. I'm very obviously still like at least like a year and a half away from graduating, but it is something I'm starting to think about. I so far I've done some shadowing at the practices near UCLA just to get a feel for what's out there. So I've shadowed both private practice oral surgeons as well as academic surgeons, as well as like some hybrid ones. I used to think that there was like a very clear divide between private practice and academics, and I'm starting to realize that that's not the case. You can do whatever your heart desires. You can create the mix, the desired mix that you want of private practice versus academic, or I don't mean, when I say academics, I mean like hospital type
Hmm.
cases. You can craft whatever scope you want. You just have to, you just have to want it.
Yeah,
And
totally.
so I've done some shadowing. I've also talked to mentors that I've looked up to and are farther out than me, or who are like 5, 10 years out from residency, who can give me advice on what their experience has been like, including the two of you. And and then I think at this point, I'm starting to start like maybe interviewing, maybe start discussing with potential practices that I may want to join in the future. It might be still too early to like nail down a job, but I would like to start those conversations now. And then in terms of like specifically what I'll do, I think I would be happiest in some combination of like a private practice type setting that allows me to have an expanded scope. I haven't ruled out like hospital based oral surgery or an academic type setting working with residents yet, but I think at least for now, this is what I'm leaning towards. So, like a expanded scope private practice type setting. And my ideal will be to find a group that already does that I can join. And so, well, I'll see in the next year and a half where I end
Yeah.
up, but that's where I'm thinking right now.
Yeah, yeah. Well, I do know that wherever you end up, whatever practice you join, they are going to be so lucky to have you because you are an excellent surgeon. So, yeah, we're just really excited to see where you end up.
Oh, thank you so
Yeah.
much.
Yeah, no
Yeah.
problem.
I met Karen initially at our overlapping Kaiser rotations. So that seems like a really long time ago, but I guess what, it was a couple years ago
That was what,
now.
2 years?
But now it seems like you're almost done, which is crazy.
I
I know.
know. I
I
actually met
can't
you
believe
at
it.
an oral surgery sister event.
Yeah.
Yeah,
Our
that was
little potluck.
fun.
It was
I
so fun.
know. Yeah.
Yeah.
But yeah, like I said, we're
Aw.
so excited for you. We know you're going to
Yeah.
do great things and
Yeah.
yeah,
And
whatever
Karen,
practice you join, they're going to be so lucky. Like, yeah, we should just send them a
yeah.
congratulations basket wherever you
Aw,
join.
thank you so much.
But
Yeah.
thank you so
Eh,
much for coming on our podcast. We had a great time and you gave us so much pearls of wisdom and I'm sure our listeners really appreciate it.
You
you
both.
are really honestly one of the few women I know that have tackled on the challenge of starting a family during residency, and it seems like you've done it so easily. I know you've talked about the struggles and whatnot, but it seems like you've done that so easily and with such grace, and just transitioning back into residency after giving birth and raising your child throughout the last couple of years of your residency. And I know that I could never have done that, so I am very proud of you. I'm very impressed, and good luck to you on the rest of your residency and thereafter.
Thank you so much to you both.
Aw.
You're making me blush.
Oh, no, it's okay.
No, truly, I'm so impressed by you. I could not have done it. It was hard enough just being on my own and taking care of myself.
Well, I mean, I couldn't have done it without a literally a village of people behind me supporting me. I definitely look up to both of you as well, and you guys also set an example for me as to what
No, we look up to you.
what
Yeah.
I might want in the future. And you both have given me such good advice about, both private
Aw.
practice and also hospital-based oral surgery. And so I wanted to thank you both as well for being my mentors.
We
Aw.
appreciate
Thanks,
it.
Karen. Thanks for
Thanks for
joining
coming here
us.
today.